Yeah, that's great. So let's talk a little bit about AI. You touched on it a little bit. Some of the things coming down the road there with all just the focus on AI machine learning. What are you think? What use cases are you seeing in the short run that you're excited about? Kind of where could this all go? And then, how do you think how should organizations or how do you think about as an organization the key question of how do you drive incremental ROI, but mitigate risk and kind of be on the right point of the wave, right, as it's coming towards us here.
Right. It's really challenging. I would say AI is probably offering one of the biggest challenges that we've had in a while because as a clinician, you want to be very cautious, right? I don't like black boxes. I don't like something that tells me what it perceives as the truth, and then I have no idea how that black box came up with that answer and whether that's helpful in any way. So what AI, I think that, and AI isn't AI. So that's the other big thing that we're dealing with now is we've got a lot of people using that term extremely loosely. Um, and what you sometimes have is just fairly well designed algorithms that are mostly not artificial intelligence. You do have some times where you are training a model to go through your data and come up with suggestions. I would say that right now, the biggest opportunity for AI in healthcare uh, seems to be around generative AI, where basically it's an opportunity to, I think, bring context out of blocks of text, to even queue up text blobs. So what it's mostly helpful in doing is taking people that have spent a lot of their day doing text based documentation, responses to patients, those kinds of things, and taking away some of the burden of creating those text blocks and summarizing a 10 paragraph note from a patient into what is the patient really talking about. So there are some
Yeah.
opportunities. You're going to see people using that, I think, at help desks and a lot of things. So you can actually do some generative things and begin to get the patient to interact and get part way through a question, maybe without ever having to get to a human being. It's things that, again, in other industries we've been used to for a while. That's what's, again, is very interesting about this is, you can imagine, when you go and you shop on Amazon, or you make appointments in other locations to get your pet groomed. There's a lot of places out there that are actually saying, what can we do that doesn't require a human being to do this
Yeah.
thing and still get the same quality? And I would say in healthcare, there's a lot of those opportunities. Obviously, and then you get cautious the more you get to where you are taking care of a patient. So that's what I think our big answers are: is what can you do with generative AI that's safe and beneficial? And then you start getting into the bigger question: is can we use more generalized or case specific AI to actually begin to look through our world of data and begin to recognize patterns in care gaps, patterns in what's coming next, or putting something together that you hadn't put together yourself. And then what does that look like? And again, I don't think anyone wants to be in a world, for example, as a provider or a physician, spending all day answering the computer's questions, it going,
Yeah.
hey, what about this? What about this? That's the danger of this. I think in some ways, in clinical decision support and a lot of data, we treat the clinicians like we're pumping out a bunch of people that haven't trained to be physicians or nurses or whatever like that. And the computer needs to sit on top of absolutely everything that they do. And what we've created is a world of burden, right? Where you spend half of your
Yeah.
time interfacing with a tool instead of taking care of the patient. So I think that what we eventually have to do is to come up with you can imagine a scenario where certainly when you have a patient that's been in your system for a long period of time, and if you could train an algorithm to put pieces of data that aren't easy for humans to put together themselves, and start to say, all right, flag these things when they occur and bring them to me, and I can then decide whether we're going to act on them. There's a world where I think that will be very helpful. I think
Yeah.
what you're going to also start to see with with these things is that everyone is looking at workforce. Again, I am no expert in what happened to the workforce, but healthcare has taken a huge blow in the last few years, and I think everybody's trying to figure out how to take care of more patients with less resources. So anything that you can do to free the human up from non-productive burden and get them doing the things that bring value, I think is going to be looked at strongly.